Transplantation Sciences unit, and will be moderating our great lecture today. First, I'm going to start off with a few announcements. We have a lot of upcoming events, one being what you see on your screen now, the SMCI Quality Symposiums on May 15th. And look forward to seeing you all there. Lisa, are posters still being submitted, or do you have an update there if you need more posters?
Yes, would love more posters, and feel free to send an email to me or put a note in the chat that I can look at later, and I'll get in touch with you about how to do that if you don't know.
Great. Thank you. Yes, so May 15th, email Lisa if you want to submit a poster of your improvement work. Next announcement is on April 29th at noon. So same time, same place. In 2 weeks, we're going to have Dr. Lori Muffly presenting on her work. And then we have the Lean Healthcare Conference coming up in September 10th through the 11th. And abstracts are due for that conference on June 6th, based on what I'm reading now. So a lot of events coming up. Look forward to hopefully seeing you all at some of these events and learning about your improvement work. Any other announcements, Lisa?
No, that's it. Thanks.
Yes. So today we're first going to get started off with a few poll questions before I introduce our speaker. So I'll hand it over to Ryan, who is the Director of Education at SMCI. Oh, I'm seeing the answer.
You should see the poll now. Do you not see it?
I'm seeing the responses right now, Ryan.
But Ryan, we only see the poll. You're good.
Oh, okay.
So there are 4 questions on this poll. So Jakari, you can't see the answers?
No, and you know I love to cheat. I'm really sad.
We'll give a minute more. We've got 47 people in the call, and we've currently got about 24 who have answered. So we've got about 15 more seconds. I think it'll give us a representative sample anyway. Now we're up to 27. Oh, they're starting to come in now. Okay, I gave about 10 extra seconds. I'm going to go ahead and end the poll. I know that not everyone did participate, but this is at least a good representation. So let me see if I'll share the results. And can you all, let's see.
That's hilarious.
Can you all see?
Yes.
So, okay. So first one.
Yeah, I don't think the audience sees the results right now. Right?
Oh, they don't.
Oh,
okay.
Yeah. Can you share your screen?
Where am
I see the results. Does anyone else not see the results?
You do.
Okay.
Okay,
you do. Me.
No, I see them. I see them.
Results.
Yeah,
okay.
I see them.
Okay, good. All right, excellent. So, well, for those who don't see it, let me read out the results. So what is SMCI? 89% got it correct. Stanford Medicine Center for Improvement. It is not Stanford Medicine continuous improvement, though that is not a bad name. It's certainly not what we're called. What does ERPG stand for? So the answer, evaluation, research, publication, and grants, 66% got that right. And then a smattering of different.
Can you scroll down, Ryan, so we can see, I don't know if you can scroll down.
Oh, you can scroll down yourself, Lisa.
Oh, sorry.
Yeah, I'm just scrolling for everyone here. Yeah, you're a co-host, Lisa, so you get to see it before everyone else does. And then when did SMCI launch? We have 2019 got the most votes, 48%, and followed by, well, as recent as 2023. So 2019, yes, and then what work group predated SMCI? Actually, I'm not sure of this one, Lisa. I'm not sure of the answer, actually.
Yeah, so we're an acronym.
Neither is anyone else.
So it was SQV, actually, which got the least amount. So that just shows how old people like me are.
Interesting. Yeah, I didn't even know the answer to that one, and I made the poll. So. All right, I'll go ahead and stop sharing and hand it over to Lisa.
Okay, let me see if I can, this is going to be the hardest part of this for me, is share. So can you help me, Ryan, with my view here to get that right?
Our slideshow, yep, you're right.
Okay.
And then now just switch it. Yep, swap. There you go.
Okay.
Perfect.
Okay. All right. Well, thank you for humoring us with that polling. So the purpose of today's talk, and thank you so much for everybody who has joined us today and taken the time, is a huge part of this is for me to be able to thank and celebrate the community that is SMCI, and all of you are part of that community. And I just am very selfishly taking this time to acknowledge and thank the many, many people that allow SMCI to exist. So that's the main purpose of the presentation today. I'm going to add that I am retiring at the end of the calendar year. And so there's so much that goes on in SMCI that I think is too much of a well-kept secret. So this compendium of information will be archived on the website. So you can go back to it at any time if there's information that you want to refresh your memory. Okay. So let me see, maybe I have to go over here to advance. Oh, okay, here we go. So just a couple of reminders that how to join SMCI. There's a link on the website, or you can just contact me directly. I'm happy to sign you up. We want to make that as frictionless and easy as possible. And also wanted to mention that we do have a presence on LinkedIn for those of you who like to look at LinkedIn, that you can find us there. Another pitch for the Quality Symposium. And if you aren't able to submit a poster, but you just want to stop by, again, it's on May 15th from 3 to 5 over in Berg Hall and LKSC, and looking forward to all of you joining us there. And then also just included for completeness, the Lean conference is coming up in September. We already have several internal speakers confirmed, as well as Kedar Mate formerly from IHI, and he's now with a group called Qualified Health AI. And then Paul Helgerson is coming back. He was a speaker in 2023 from the University of Virginia and a wonderful lean leader there. And as Sam mentioned, this is the call for abstracts. So this link, and I believe, Ryan, this is live now on the SMCI website. If you want to go there to submit your abstract. So we have until June 6th to do that. So again, this is a conference where 50% of the conference is from the attendees. So really looking forward to your participation in that. Okay, so let's go back to that question that so few people knew the answer to, the beginnings of SMCI. So it started off after Dean Miner had convened this group called the Safety Quality Value Committee, and that was way back in 2014. And Dean Miner realized, he was really the only one who was sharing best practices in patient experience and cost effectiveness and quality improvement and quality metrics across the adult hospital, the children's hospital, and Tri-Valley, other parts, PCHA, Stanford Medicine Partners. So he convened this group. He said that was one thing the dean had, was the power to convene, even though, he's not the director over all of those entities. So then that morphed into the integrated strategic plan in 2017, had a aspirational goal of a center of excellence and improvement. And thanks to so many people, starting with Norm Risk, Denny Lund, the two chief medical officers, and then two leaders who have stayed with SQV all the way through, Terry Platchek and David Larson, came up with these, what I think are really timeless founding principles about creating value for patients. People are our most important resource. We strive to be the best at getting better. And then we support our leaders to foster an environment of improvement. And I think all of you on the call today, you firmly believe in that. This is our organizational structure. I'm not going to spend too much time on this other than we have the blessing of our CEOs and Dean Miner, our two chief quality officers, Grace Lee and Paul Maggio, our executive sponsors. And about a year and a half ago, Terry took on the mantle of executive director of SMCI, and I'm his administrative partner. We have a very prestigious advisory committee. And then these work groups have morphed over time to where we'll spend a little bit of time talking about the work groups and our affinity groups as well, and who leads those. And this is our executive committees. So we meet monthly, and we have the chief quality officers and the VPs of quality. And Jesse's title is a little bit different. She's the vice president for the Center for Pediatric and Maternal Value. And then we are I can't see if Selena's on the call today, but I'm just going to mention Selena Mace's name about 100 times because in addition to supporting the center and center educational activities, supporting this lecture series, I mean, she wears about 50 hats and very ably supports us in SMCI. And unfortunately, Selena very abruptly lost her father a couple of weeks ago. So she's on some very much deserved family leave to help her family at this time. Okay, I'm not going to belabor the next couple of slides. Again, this is more of a slide that's for the compendium of activities that have taken place over time in SMCI, but I did want to just take the opportunity in putting up this timeline to give a shout out to a few folks. Ame Alcantara and Ben Elkins were partners with me when we launched an exploratory group in early 2019 to just see, did it make sense to have a center of excellence for improvement? And so we had a working group that met prior to the start of this timeline for about 6 months. And I wanted to call out a few folks who were very instrumental in helping us in just decide the efficacy of having a center for improvement. So most notably, Ben Elkins, also folks like Arnie Milstein, Sarah Singer, Steve Ash, Marcy Winget, and Laura Holdsworth. We just had this multidisciplinary group, including patient and family members that met for a long time. And then these next few slides go over the timeline of just launching some of the activities, the core activities of SMCI, including the website, the newsletter, some of the previous external funding awards that we got. We received $250,000 right off the bat thanks to Sarah Singer and Karen Fresh and Tate Shanafelt, through a an award we received from PCORI via RAND on physician protecting physician mental and physical well-being of frontline healthcare providers during COVID. So there's been a lot of work over a number of years. And then I want to continue shouting out certain people, Terry Platchik, David Larson, also our previous CQOs, Karen Fresh and Lane Donnelly, early supporters of getting SMCI off the ground. So continuing this timeline, you just see some of the activities repeated, but then we had some new activities over the years, like the Lily Donnelly Seed Grant, which I'll talk about more in a bit. Also SMCI partnering with Stanford Medicine Children's Health on the Lean conference. So we started that activity being a routine part of what we do. And then also working on the quality symposium. I'll get into more of that in just a bit. But again, these slides are a complete picture of our timeline for purposes of going back to this information for anyone who's interested in knowing the details. Okay, the center launched at probably like the worst time to launch a center, because we launched right as COVID-19 hit in March of 2020. But and so we are a bit behind in our goal as a center was to be 100% self-sustaining financially at this point, and we are not there yet. And so when we talk about the value of the center to external groups, our executive committee, we've kind of come up on bucketing our activities in these 4 areas: improvement capability development, Stanford Medicine brand promotion, convenings on improvements in medicine, and then improvement scholarship. So I'm just going to walk you through how is the center performing, or what activities do we have to support or that are in support of these 4 emphasis areas. And so I'm going to start my shout outs with Sherry Nakamura and Jake Mickelson. They co-chair our education work group. And so as a result of their advocacy and their partnership over many years, we now have much better visibility into the educational offerings at Stanford Medicine Children's Health, Stanford Healthcare Tri-Valley, and of course Stanford Healthcare. And there've just been many activities. And just another huge shout out to Jake and the PI team that started off creating some improvement of videos that were a refresh of the original Right videos. I think we started off that video series with maybe about 7 or 8 videos, and it's up to 23 because the team kept exploring gaps in knowledge and responding to pull from our customers who love to look at these videos. And we're really proud that these videos, along with now the videos from the Packard quality management system, and we'll get into the toolkit in a bit, but that all of those are accessible, largely accessible to the world on the SMCI website. And that's just a ton of work, a ton of dedicated work by many people on PI teams. Another thing we're really proud of at SMCI is our advanced course in improvement science. And this was really the brainchild of David Larson in wanting to put together a course that Stanford Medicine attendees could attend locally. Prior to that, once folks had gone through the Realizing Improvement through Team Empowerment or the Clinical Effectiveness Leadership Training, and now Ryan has the specialist course as well, that is not sponsored by SMCI, but by the Stanford Healthcare PI team. There just wasn't a place for people to go, and that's what ACES was created to respond to. So instead of having to go to Intermountain for the advanced training program there, or Harvard or IHI, we have our own locally grown and developed course. And just huge kudos to Ame, Ryan, Candice Garcia, David, Selena, Terry, all those folks put just so much blood, sweat, and tears into each of the ACES cohorts. Ryan emerged as a graduate of cohort 2, and then we've asked for Ame's assistance in subsequent cohorts since first launching this program in 2020. So when you look at the photos of previous cohorts, cohorts 1 through 4. If you look at cohort 1, that is a screenshot from Zoom, because believe it or not, for 20 days, we had 20 days of 8-hour instruction via Zoom for cohort 1. And then as we were coming out of cohort, out of COVID, we had part of cohort 2 was able to be face-to-face, and then we've had the subsequent cohorts have been able to exist or be launched face-to-face. And the foundation for ACEs has been the Deming domains of profound knowledge, those being appreciation for a system, understanding variation, the theory of knowledge, and then psychology, or the human side of change. And every single cohort, we just kind of tear apart every single session on each day of each cohort to make that program better and better as time has gone on. And just, again, so grateful to everybody that contributes to those efforts. And this is our cohort 5 that we just finished last week. And, someone missing from this picture is Selena. We very much missed having Selena at the conclusion of cohort 5. So another labor of love, we have put out 53 monthly newsletters since we launched ACES. And I really want to give a big shout out to Terry Ard. So Terry, from the very beginning, has been our editor-in-chief and the founding producer of the newsletter. So we get inputs from all kinds of folks every single month, but Terry, Selena, and then Kathleen Lacar from the Catalyst program from Stanford Healthcare. We get together every month, but it's Terry who, most times it's a Sunday night, maybe even like 11 p.m. on a Sunday night, when Terry is sending me the proof of the newsletter, and we get this thing out and we archive all the newsletters. We are doing a refresh on the archive right now to make all the links live since we switched to the new website. But again, so you've got 53 newsletters that have tons of information and great knowledge that you can go back to reference over time. 2 other folks that do just an amazing job, and we're now on our 5th annual SMCI Excellence in Publications Awards. So the first year that we did this, I think I kind of put it together very inexpertly, and then Dr. Samantha Kling, and with the assistance of Anna Lesios, have taken this over, and they have a much more rigorous process for evaluation of publications now. And in May, we will be, or later this month, we'll be announcing the winners of the 5th annual competition. And these are the categories that we award winners for: the best publication for covering an adult population, a pediatric population, a publication that highlights the work of healthcare workers. And then this is a new category we started last year, publications that were first authored by a trainee. So again, just huge thanks to Sam and Anna, who coordinate all the details of getting the publications out to our fabulous teams of reviewers, and then coordinating the awards and certificates and an awards luncheon, which is a really nice event that we have after we do all the announcing of the awards. Another great friend of SMCI is Natalie Cheng. Natalie and Selena have coordinated our membership list of fellows and affiliates since the very beginning. And you can see that we have really grown in our membership over time. We're up to date, we have about just under 3,100 fellows and affiliates. And to be a fellow or an affiliate, you just have to say that you want to be part of SMCI. But fellows are folks who have graduated from our ACES program, or people who have raised their hand and said, I would like to put in a little bit of extra work for SMCI. And you can apply via the website, or you can contact me if you're interested in being a fellow. And we really are leaning into our fellow community for more support of SMCI. And at the moment, we've got about a 17% increase over FY24. But for everyone on the call, I really appeal to you, if you are a supervisor over a large or a small group of employees, and they are interested in understanding more about SMCI, if you send me your distribution list, we can easily add folks. It's very straightforward if they want to be taken off of our distribution list. But, just the word of mouth of getting the newsletter, of getting invites to like this lecture series, it's super helpful for us to connect with people who want to be part of this community of improvers. So please let us know if you have more folks. And again, we have a presence on LinkedIn if you want to connect with us that way. And thanks to Ame and Ryan, who both coordinate our LinkedIn presence. So I think I have to kind of click through this to get all these photos. So this is information. Now we're switching to the category of convenings on improvement in medicine. So this is our annual Lean Healthcare Conference. These are some photos from last year. And so you can see that we do have quite a heavy presence of first-time attendees at this conference. So 57% were first-time attendees, but we had 31 different institutions, about 240 attendees from, I think I might have to do one more click. From 3 countries, 70 posters. So this is a fabulous event. It's just a 2-day event, and we do charge admission, and that's mainly to cover the cost of the venue, and the food is largely why we do that. But it's a great opportunity for you to really get up close and personal with national, international leaders in improvement science and make connections beyond Stanford medicine, and that can be very deep connections that you will have for the remainder of your career. Another terrific convening that we do that we talked about that's coming up on May 15th is our joint effort with the Resident Safety Council with Lisa Shea and Louisa Ortiz, who support the resident poster judging part of this convening. And a new feature we're going to have this year in this quality symposium is that we will have rounding on all posters. So the non-resident posters, last year it was kind of more catch as catch can, and this year we're organizing formal rounding, not judging, but rounding, so that participating in the quality symposium this year, you can be assured that leadership will be rounding and have awareness of your improvement activity. I can't say enough about the dedication of Lisa Shea and Louisa Ortiz and Selena Meza in coordinating this event. There is just a ton of work that goes on behind the scenes, weeks and months before the event. And I so appreciate their dedication to this. And Lisa, in particular, is so passionate about resident learning in improvement science. And we all know residents are on the front line of everything that's wrong with our healthcare system, and they have some of the best solutions. So I'm very proud to partner with Lisa and Louisa on this event. And then that photo on the top right that you see, Louisa Ortiz and our fabulous group of volunteers who helped us out last year. And we have, I think almost everyone has signed up to help with this year's event, but I want to call out Leslie Lara from the OCMO, who coordinates the volunteers for the day of event, and we really appreciate your support, Leslie and team. So this particular event, the lecture series, and I don't have the number of lectures to date to share with you right at the moment, but the lecture series is very much a labor of love, and just huge shout out to Selena, Sam, Sabrina, Katie, Laura, and David Crichton, because although, it may seem pretty straightforward that we just get a speaker and we announce that we're having a lecture, the recording of this event, the gathering of the CME codes, the publication of the event. We also do an appreciation certificate and then post the slides and the lectures on the website. So all of our lectures, so we've been in existence now for about 5 years. So we have We typically have about 24 lectures a year, so we probably have over 100 lectures that have been archived on the website so that you can access them if you missed the lecture live. You can go back to the lectures. And again, this is a labor of love. We call this group our brain trust. And I'm just so indebted to everybody whose picture is on this slide for your many years of service and dedication and keeping the lecture series going. More convenings on improvement science. So this is a group that's morphed from the Teamwork Advisory Committee, and it's now called the Teamwork for Transformational Care lecture series and affinity group. So huge thanks to Ryan Dark and Joe Carlucci and Joe and Ryan and team. They came up with a way of, instead of just having once a month some sharings that were pretty limited on advancements in teamwork and patient safety, this is now morphed into an every other month lecture series. And the beauty of this is that we rotate, or that group rotates, who presents each month on this lecture series. So we have Stanford Healthcare, Stanford Healthcare Tri-Valley, Stanford Medicine Children's Health, Stanford Medicine Partners, and the Packard Children's Health Alliance have all agreed to rotate sharing of a best practice in patient or employee safety. And again, these get archived and shared on our website each month. So it's a lot of work publishing these things and putting them together. And thanks so much to Joe and Ryan and everyone who helps with that activity. The Stanford Community of Improvement Professionals, shout out to Ryan and Jakaria. I believe, Ryan, this was your ACES project to launch this group, and then it's remained extremely active, and you don't have to be an improvement professional to join this group. So you could reach out to Ryan or Jakaria or go to the website, the SMCI website, and look at SCIP. And again, this is just a fabulous way of building community, so awareness of who's doing what in different entities in Stanford Medicine. Also shout out to Michael Rothman from the School of Medicine, who's also part of this group. So bringing together people that they share tool time, they share best practices, they share struggles, but they also do really terrific icebreakers to get to know each other, and so that there is a shared community of improvers, so that you have friends in other places when you have a problem to call upon. And again, they archive the recordings and put them up on the website for sharing at a later date. So one of our original groups, again, now we're moving on to the area of improvement scholarship. So this is that odd acronym ERPG, the Evaluation, Research, Publications, and Grants Work Group. So this is a group that is created supportive structures and programs to support quality improvement efforts, evaluation of quality improvement, and enhance our capacity for learning and our reputation as a leader at the intersection of research and quality improvement. So on our website, you can see the charter, but just want to give a shout out to Steve Ash, who has been a leader on our ERPG group since its inception. And thanks to Alice and Anu, who are new members of this work group. Alice is our coordinator and is just doing an amazing job coordinating the ERPG, taking over from Sam, who did that role for many years. So huge thanks to all of them. And then I also wanted to shout out someone not on the slide, is Sarah Singer, who was the previous co-chair prior to Anu joining us. And Sarah now has an even bigger role. She has many, many roles, but one of them is that she's the director of the Stanford Distinguished Scholars Institute, and she's also faculty director of the Health Leadership Innovation and Organizations Lab. So Sarah's another great friend of SMCI. Also on the theme of improvement scholarship, I just want to underscore, and when you hear about this patient-centered Outcomes Research Institute Health Systems Implementation Award, that's a big mouthful. But when we first heard about the Health Systems Implementation Initiative through PCORI, this was right as Lane Donnelly was leaving Stanford as the chief quality officer for Stanford Medicine Children's Health, and Terry Platchek was, I'm sorry, Stephen Roth was the interim CQO at that time. So when we thought about applying as Stanford Medicine, everybody said, no, you can't do that. That is not going to work. You can't cross all these different legal entities to get a joint award as Stanford Medicine. But Grace Lee and Paul Maggio said, oh, no, we can't do this. And just huge kudos to Grace and Paul for their fortitude in making this happen. And then we were so ably assisted by Kim Stern from the Maternal and Children's Health Research Institute. So we've got some of Kim's time. We've been able to purchase some of Kim's time to put this thing together, but it really was moving heaven and earth to get this initial award. And Orchid Lee has now joined that team, and Hayden Schwenk got one of the first awards after we were accepted into the HSII. So the way this has rolled out is that we got a $500,000 capability grant, and you have heard at this lecture series before about the website and the toolkit that we built as a result of that. And then Dr. Hayden Schwenk and Grace Lee are the PIs on the first award, the first project awards that came out last October. And so they got about $1 million for this design and implementation of evidence-based strategies to ensure antibiotics are prescribed for respiratory tract infections only when clinically necessary. So kudos to Hayden and Grace for jumping on the very first award opportunity and being successful in that. And then you have seen this again on this lecture series. You've seen demonstrations of the toolkit, but just wanted to shout out again Cassie and Sam, who led this effort. There are over 200 resources, including tools, templates, and videos. And for those of you who contributed to that effort, Joy Gore just approached us and said, hey, I want to update some of our templates. So if you have contributed previously, just let us know. And Cassie and Sam are assisting in uploading updated templates as time goes on. So this is certainly a dynamic process of when we have additions to the website, we can just go in there and make those updates. But we also took this opportunity to do a complete refresh of the website. So I hope that you're continuing to find it more visually appealing and pleasing and easier to navigate. Also on the theme of improvement scholarship, thanks to Altos Ventures and a generous gift from them to John Lilly and Lane Donnelly. So that was another gift that Lane gave us before he left, is putting the Lilly Donnelly seed grant awards into SMCI. So we have had $500,000 and been able to, again, with assistance from Kim Stern and Orchid, we have had 2 cycles of awards in calendar year 23 and I'm sorry, fiscal year 23 and 24 to various investigators for the betterment of child and maternal health. And I believe this is getting close to my last slides here. We just received notice that we have another $500,000 gift, and you will be seeing details of that. If you saw the newsletter that came out on Monday, we announced that details of that are going to be forthcoming later this month. And so we have another $500,000 gift, and that is specifically going to be focused on increasing access to improve care for child and maternal health. So more coming soon on that. But again, Kim Stern and Dr. Stephen Roth were the 2 folks that when we announce the seed grants and we select recipients of the seed grants and then administering the seed grants and giving information back to the donors, they just do a magnificent job of packaging all of that. And it is quite an effort, and they just have done it absolutely brilliantly. And this is my last slide. So again, this is here more for information than anything else, but I don't know, Brian, if we have any questions in the chat, but I was going to go ahead and stop sharing and just see if there's any discussion or any clarification I can give for that blitz of SMCI. And I just hope that all of you, in hearing all of these things that SMCI does, it is very much a community of improvers. It's a community that respects every participant at every level in the community. And I just, again, want to say how personally grateful I am to everybody that I called out and the many folks that I missed in reviewing the activities of SMCI. It has just been a great joy for me to be a part of this. And I will stop with that.
Thank
Lisa,
you.
there aren't any, no questions in the chat currently.
Yeah. But a lot of information flying around in the chat, but I would love to thank you, Lisa, for your leadership through SMCI in the past 5 years, and congratulations on your retirement at the end of this year. I know many of us, but myself personally, are going to miss you a lot, but looking forward to helping us build for the future in the next year. So if you have a question, please feel free to come off mute or put it in chat. And if there's something you would like to learn more about, as Lisa put up her email, but there's always ways to get involved in SMCI and all these work groups. Yes, and I will shout out Skip, Ryan Dark's Skip group, a great place to really get great feedback on improvement questions and processes, and really open group to any problem you might have. Question about where to find the lecture series information on the website. So I will post a link, but it's under events, where we have all the lecture series, documented, and the videos available. And on our homepage, you will always see the dates for the upcoming late lecture series, and information about that.
And due to Selena being on leave, I've kind of learned more about how that actually happens. So what will happen is we create a PDF of the next lecture series. So Lori's series is going to happen on the 29th, and that will likely get done by the end of this week. And then what has to happen is we put that PDF into a Zoom invite and then have to manually push. So if anybody on this call has a better way of doing that, let us know. But we have to manually push that invite. It goes from the host calendar to 500 people at a time. So that means 6 emails of 500 people on the email at a time to get that on your calendars. If you are an affiliate or a fellow of SMCI, and then we also advertise in Stanford Medicine Pulse. And they put that up. They usually put up our information about a week before the date of the lecture. You see, Maggie, if I can see your question here. What do you envision as the high priorities next and if SMCI for the next 1 to 2 years? So I'm not gonna kind of sugarcoat it. I think we're in for tough sledding with the state of, I won't inflict my politics on all of you, but just the state of chaos with this administration and federal funding for education and healthcare. So it's going to create a lot of challenges. So I think one priority is just, being able to continue to exist And we're really going to have to be judicious that the SMCI activities absolutely 100% align and support with Stanford medicine priorities. So I think there will always be a priority on improvement science, education capability. So to the extent things like the lecture series can very much be aligned with improving all of your knowledge about how to improve. And then courses like ACES, how ACES is supporting advancements for those who are advanced improvers and people who improvement is part of their job, part of their leadership, just part of the way they operate. That'll be a great investment. I also think the scholarship, we have to be demonstrating the value of celebrating scholarship and promoting scholarship. And so already for PCORI, for any new opportunities at PCORI, we do have a steering committee that is comprised of the top administrators. And so we need the go-ahead from those top administrators to even pursue application for a PCORI opportunity to ensure again that it aligns. But I would just say align, and we have to demonstrate our value that what we are doing is supporting improvement of the front line. It's supporting this feeling of being respected, being appreciated for the front line of our culture of safety, that just all of our activities are lockstep with the priorities of Stanford medicine.
Thank you so much, Lisa. We're going to dearly miss you, not just your leadership, but also the energy and the personal warmth that each of us have experienced from working with you.
Other questions from the audience? I would love to tag on to Maggie's question, and I think something you said earlier, but where do you need, so SMCI is really dependent on volunteers, which as someone new to Stanford 5 years ago when SMCI started was a great opportunity to meet others. So where do you see the need for more volunteers or the need for more efforts under SMCI, Lisa?
So I'm really going to make a plea for the newsletter. I don't know how much you all, if you even, we do have the open right on the newsletter, but I would just say the whole bucket of newsletter and communication in general, that, I recognize how busy everybody is, but boy, if we had like 10 people that, each one would agree to give an hour a month, gosh, it would really lighten the load, and I think help us so much with just getting the word out that this place, this Stanford Medicine Center for Improvement, exists, and that it is a place for you to connect with fellow employees in problem solving, just as basic as that. And I just think, one thing we all need more of now is connection. And then that connection can lead to, understanding each other's interests. And so, I have an interest in, publishing. I have an interest in improvement in X area. I'm part of Stanford Medicine Partners, and I don't know how to connect with so-and-so over at Stanford Healthcare or Stanford Children's. It's just, if we really could increase awareness of SMCI and the fact that this free entity exists for you to connect with one another and support one another and problem solve with each other, that would be terrific. I think just I'll say that as simply as that if we have more people in SMCI and they know each other and they want to help each other, then that can lead to more hands for specific areas within SMCI, but it just all starts with joining.
Lisa, I think we have time for one last question if there's one out there. Okay. I see. We usually try to end about 10 minutes to the hour to give everyone time to transition to their next meeting. But thank you so much, Lisa, for that great overview and all the service you have done. And I hope everyone joins us at our many upcoming events, all listed on our website, and hope to meet you all in person. Thank you and have a great day.